Hello, welcome to ANA community. In this particular video, we are going to discuss the examination of nose and its significance in general examination. From the past several videos, we are looking into the significance of general examination, sequence of general examination, and we are having the discussion on different aspects of general examination and their significance. As far as examination of the nose is concerned, we need to know about the brief functional anatomy of the nose. When you think about it, this is the part of the root of the nose. The purple colored arrow that shows the root of the nose. This is what we can say the bridge of the nose. This is what we can say the root of the nose. And on the either side, what we can say, that is we are going to have wings of the nose, or otherwise that is also being told or called as alae nasi. And further, on either sides of the nasal septum, there is an aperture which is being termed as nostrils. This is the method of examination of nose, wherein we are going to pull the tip of the nose a little bit upwards, and after that we are going to see the inside of the nostrils as such. To know about any kind of the discharges, to see about any kind of the discoloration, etc., to see any deformities being observed on the nose, etc., that will be analyzed. This is the most commonest sign that we are going to see on the either sides of the nose, which is being termed as butterfly rashes. This is specifically seen in the patients of systemic lupus erythematosus, which is being, in short, that is being termed as SLE. This is what we can say the movement of the alae nasi. This is specifically seen in the persons who are having the nasal obstruction. That means who are having the effortful breathing. They are going to have the movement of the alae nasi. When the person is having effortful breathing, he will be having the movement of the, sometimes he may have the opening of the mouth, wherein the extra in air that will be entering into the respiratory passages. The person may have the action of sternocleidomastoid muscles and intercostal muscles. There will be the action of intercostal muscles also will be observed when the person is having the effortful breathing. So here, this is one particular sign, there is movement of the alae nasi that will be observed there. This is what we can say in the persons who are having the, what do you say, that the abscesses, specifically in different parts of the face, specifically seen in cases of acne vulgaris. So here, in the nose, this is being observed there, just above the tip of the nose, this is seen. This is a pink colored swelling which is present on the either sides from the lateral to medial. We are going to see this is termed as hypertrophy of inferior nasal turbinates. This is indicative of chronic respiratory diseases. This is what we can say the deviated nasal septum. See this, the left nostril we can see prominent passage there, but on the right nostril we can see the womb, that is the nasal septum as such. This is indicative of the deviated nasal septum. This is indicative of the nasal discharges. Sometimes it may be watery in color, sometimes it may be having the yellowish color in as such. This is indicative of the rhinitis or sinusitis, etc. That means infections related to upper respiratory passages. This is observed in the persons who are having the, what do you say, that epistaxis, can be seen in physical trauma, can be seen in head injuries, can be seen in viral hemorrhagic fevers, can be seen in hypertension. This is one of the commonest finding that can be seen when the person is having upper respiratory, that is the obstruction, that is obstruction of the nose completely, wherein the person will be taking the breath through the open mouth, which is an indication of the respiratory disease as such. Take-home messages from today's discussion. Nose should be examined as a part of general examination. Some of the signs that can be indicative of certain diseases, such as butterfly rashes in cases of systemic lupus erythematosus, movement of the ala nasi indicative of respiratory obstruction, that too in the upper respiratory tract obstruction, abscess formation in case of acne vulgaris, hypertrophy of inferior nasal terminate indicative of chronic obstructive respiratory diseases, deviated nasal septum can be seen in case of trauma or in case of congenital malformation as such. Nasal discharge may be seen in rhinitis or sinusitis. Nasal bleeding can be seen in trauma or hypertension or head injuries, etc. Mouth breathing is a specific form of we need to know about it when the person is having complete nasal obstruction. Dear ANA members, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in this particular channel? Mention in the comment box below. And spread this particular video to maximum number of true Ayurveda learners or true Nidana learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.